If you look on the rear, which is usually where most people hold their tension, most people think of your traps as just being on top of your shoulders, but as you can see, they start from almost the middle of the back and they go all the way up to the shoulders and all the way to the back of the neck. And generally when people have upper back pain and muscular problems, that's one of the culprits. But hidden underneath, there's our little friend, the rhomboid, which will cause, if it's too tight, it'll cause scapular retraction. Sometimes at the end of the day, I don't know if anyone here works at a computer, or stands a lot, you get that burning in your back. Well, this is one of the root causes. And just outside of that, you have your deltoid muscle, which is often confused as part of your rotator cuff, which has really, it stands over it, but it does not function as part of your rotator cuff. If you look on the other side here, which you guys don't really, but you can kind of see, you have all your rotator cuff muscles. Now they all stem from your scapula, which is your shoulder blade, and which is the same housing for your shoulder. So your actual arm and shoulder isn't really attached to your body except for slightly by the clavicle. It's all muscular. And then if you move down and underneath, you have these muscles called your erector spinae. People call them your back straps. You can see more muscular people, the straight line down the back, and that's caused by that muscle. And just over and to the side of that, you have your latissimus dorsi. Guys at the gym call it the lats. And that's why some of the beefcakes walk like this around the gym, because theirs are overdeveloped. You get into this white thing, it's called the thoracolumbar aponeurosis, which is just a connective tissue made of fascia that covers the lower back muscles. Now, unfortunately, you can't really see too many of them, but if you look on the inside, this is your hip flexor muscle that attaches on the front to the inside of your hip, and it originates on your lower back. So a lot of times if you have a problem, if you're sitting down, you got lower back problem, you kind of gotta, it's that muscle. It's actually a hip flexor and not even a lower back muscle. But beside that, you have a muscle called your quadratus lumborum. They call it your hip flexor muscle, which also causes a lot of lower back tension. And when that muscle sits between your ribs and your pelvis like this, and when it gets tight, it pretty much accordions your lower back. So some of these techniques, there's some stretching that I'll show you, will help release all the musculature through there. Now, on the anterior portion, the opposite side of the trapezius and the rhomboids, you have the pec muscles, which people with too tight of pecs or people with poor posture, those muscles tend to get short and make it hard to create an open posture. So I'll show you some stretches and some ways to keep the chest open as well. And then we all most know the hamstrings, the glutes or your buttocks, the calf muscles. There's actually two, it looks like two here. These are just two heads of one, but there's one underneath called the soleus, which if you've ever been sore after running and you kind of, the pain is on the side, that's normally your soleus and not even your calf. And I'll show you some stretches for that. Then you have the quadriceps.